you say the goal isn't to get your loved one to admit they're sick, but to get them to follow the statement, I'm not sick, with the statement, but I could use some help. And
Right.
the way you do that is through these communication tools that you've developed that you call LEAP.
Mm-hmm.
So
Yeah,
can you
LEAP.
tell us a bit about that?
Sure. I mean, LEAP stands for listen, empathize, agree, and partner. It's not any usual kind of listening. I mean, do you need another psychologist to tell you that listening is important? No. But LEAP, reflective listening, is very specific, and the goal is to communicate respect and a lack of judgment. So when someone says to me, someone with schizophrenia, for example, there's nothing wrong with me, I'm not sick, what I need help with is a CIA that's surveilling me. Well, if I'm going to reflectively listen using the LEAP approach, what I'll say is, let me see if I understand you, Melinda. You're not mentally ill. Your biggest problem is the CIA. They're surveilling you. They're watching you. Did I understand you? So there's three parts to that reflective listening. A preface, I reflect back what you said. I ask you, did I understand you? And what happens is people often just calm down and sometimes make the mistake of thinking I agree with them. LEAP is not dishonest. LEAP, you're never lying. I'm never saying, it sounds like I'm agreeing, right?
Mm-hmm.
You're telling me, Melinda, I mean, let's imagine you said that to me and you had schizophrenia. What you're telling me is you're not mentally ill and your problem is the CIA. Did I get that right? I'm not agreeing with you. I'm just reflecting it back. So if you were to ask me, well, do you believe me? The CIA is watching me. One of the other LEAP tools is we try to delay giving those opinions so we have more opportunity for this respectful, non-judgmental communication. So I would delay. Melinda, I promise I'm going to answer your question about whether I believe the CIA is watching you. Before I do, could you tell me more about what happened last night with the CIA? You said something happened. I get you talking some more. I'd reflect it back. I'd be empathic. So you're really scared and angry? I'd be scared and angry too. That's the form of empathy we teach, which is to normalize the feelings. I'd feel that way too. The whole goal is to close the distance between me and the other person and to be respectful and non-judgmental. So reflectively listen. I get asked my opinion. I try to delay answering so I can do more listening, more empathy. And then when I do give my, let's say somebody asked me, do you think I should, it sounds like you agree with me that I'm not mentally ill. They make the mistake because I'm reflectively listening. Do you agree with me? Then we give our opinion in a very specific way with the LEAP approach. We call it the 3 A's: apologize, acknowledge our fallibility, we could be wrong, and ask the person to not argue, to agree to disagree. So if the person asks me, do you think I'm mentally ill? I'll say, I'm sorry, you've asked me a few times because I've been delaying. They've asked me a few times. I'm really sorry, and I could be wrong. I do think you have some issues, some mental health issues. Yes, I do. And I hope we don't have to argue about it. So there's those 3 elements to giving an opinion. But what's the headline? I'm giving my opinion in a soft manner, in a humble manner, not in a hitting the person over the head manner, like I used to with my brother, and I used to early in my career with my patients.
Yeah. I watched one of your LEAP training videos where it was a role play for the common situation where someone has just gotten out of the hospital and they throw their medication away. So in the video, it showed the loved one finding the pills and coming and talking to them about it and walking you through how you'd handle this in the LEAP manner. And I was actually surprised by the outcome because at the end, the loved one was like, okay, you want me to throw them out? I'll throw them out. And they go throw them in the garbage. I'm anxious watching this and you said it was a successful outcome. So I just wanted, why do you say that? And could you kind of talk us off the ledge here?
It goes back to your question a few minutes ago, that the relationship is of primary importance. If the person is throwing away medication, right, it's already in the garbage. I don't lose anything by putting it back in the garbage if that's what they want me to do. I've lost no ground whatsoever, but I've gained ground because I've listened to them. I've been respectful. I've given my opinion. I said, well, the doctor said you should be taking this, but you don't want to? No, I don't want to. Can I keep it? She asked in the video, can I keep the medication or would you rather I throw it away? She's trying to keep it. And he says, I'd rather you throw it away. And she does. What happens? The relationship strengthens. And that video is based on an actual family I worked with. And that loved one actually ended up accepting medication and staying on it. But it was through that relationship. He did it for his wife. He did it for her because she asked him. And he didn't do it because he thought he was mentally ill. He didn't come to understand that he was mentally ill. And that's something we haven't talked about, that the nature of anosognosia is it doesn't tend to improve with treatment. So you've got to find a different reason to help the person choose treatment. It's not because they think they have a problem. It's because they feel loved and respected and not judged by us. And we would like them to be in treatment. So they do it for us, like my brother said. So in terms of talking you off the ledge, she didn't lose anything by throwing the pills away. And what she gained was her husband feeling really respected and loved. And when you stop pushing against someone, it's called the change paradox in psychology. You just sort of go with them like she did. People then tend to be willing to change. And in his case, he changed and did ultimately accept treatment.
So what would be the next step? Let's say that happens. Your ultimate goal is to get them to be taking the medication. So then what? They've thrown out the meds. Now what do you do?
How do you feel about me throwing out the meds? I'm really glad you did that. Can I tell you how I feel? And then you express your feelings. Look, I'm sorry, you're probably not going to like this, but it scares me. I'd really like you to be on the medication. And I'm sorry I feel that way. This is the 3 A's I was talking about. And maybe I'm wrong. Acknowledge your fallibility. And I don't want to argue with you, honey. I just would like you to try it. Not because you need it. That's not the focus, because that's educating again. I just like you to try it. And those are the kind of conversations she had, the real people that story is based on, with her husband, that led to his saying, okay, I'll do it. I'll go to the appointment. First, they went to an appointment together. And then he started meeting with a doctor who developed a relationship with him, and he was willing to try treatment. And he did.